I never planned to be homeless, but like, there's a point where you'd rather die on the streets than you would being hurt or even just not feeling comfortable beside someone else because you're scared of what they're gonna do to you.
I have not met anyone who is homeless that is there by choice. They're there because there are no good options for them.
Yeah, no, a shelter is not great, but it's 10 times better than sleeping on a sidewalk or on a park bench.
There is not an empty shelter bed in this city, ever. And so encampments exist because other opportunities don't exist.
Living in a tent is terrible. It's not warm whatsoever, not windproof. All you have pretty much is a roof. And I think police came at 9 o'clock in the morning to evict us from our tent. At first, I was distraught, but like when I found out that there was a spot available at the hub, like it felt like God had given me a second chance.
Hubs create safety and allow for stability, and then the goal is then to move people as quickly as possible into permanent housing.
The staff there are so great. They help you with whatever you focus on, but they still are always there looking for housing for you and supports, whether it's mentally, emotionally, physically, like with doctor's appointments.
So that hub is that first place of where they can be safe and feel safe, and then start thinking about what are my needs and how do I go forward in those needs, knowing that it's still a journey ahead of them.
I want to go to school to be a social worker because I feel like no matter what state someone's in, they're always still trying to like get better. And I'm so happy that they actually were creating a hub because it's more for the kids that like really have nowhere else to go, nothing else left. And those kids have that support at the hub because those staff care and they go out of their way to ask if you're okay and get you the support that you need, or just give you the time that you need, or talk to you for 5 minutes and treat you like a normal person.
Good evening, everyone, and thank you for joining us tonight to hear about your generous support and contributions to the Health and Homelessness Fund for Change. My name is Diane Silva. I am the President and CEO of InterCommunity Foundation. The video that we just shared with you is Erica's story, but there are many, countless other untold stories, like people like her that come from many walks of life. Like Joe, who moved into the House of Hope last October, a young man who lived in foster care during his childhood and endured trauma. And once he aged out, he had been living unsheltered for many years. And think about it, this is a young adult. And so thankfully, the House of Hope opened up a space for him to have permanent supportive housing. So my point to you is that people, no fault of their own, with life events that push them into the margins. I really believe that homelessness doesn't discriminate. All it takes is one major life event that changes our lives forever. As a foundation, we've been talking about how inequities permeate all aspects of life: historical trauma, racial injustice, poverty, and these are just some of the examples. But there's also climate that impacts those the most living on the streets. Barriers to healthcare, education, and stable housing all intersect, making life inhumane for many. As we are gathered here tonight, we can't ignore the countless people who continue to live rough outdoors. And yet this is the one thing that has unified all of us, and this is why we're here tonight. I'd also like to take this moment to acknowledge that almost 30%, if not more, of those experiencing homelessness in our community are Indigenous. This is no coincidence, but a direct result of historical displacement, system inequalities, and ongoing barriers to housing and resources faced by Indigenous peoples. As we continue to discuss solutions to homelessness, we will continue to commit to centering Indigenous voices, addressing the root causes of these disparities and working toward equity for all. This is why, as a foundation, we made the decision to work with the anonymous donor family, knowing that their values align with our values, as well as through our commitment toward actions and reconciliation. London Community Foundation and our board are deeply grateful for the anonymous donor family for making this historical gift of $25 million, plus a community match campaign, with the mission to give people a better chance at life, stability, and solutions towards permanent housing. Through the anonymous donor family, their vision, I believe this gave our community hope, which we'll hear more from our speakers tonight. And it's through that the whole of community system response would not be possible with each and every one of you. I can tell you from my perspective, having worked closely with the anonymous donor family, Jeff Macoun, our co-chair of the community fundraising campaign and the fundraising committee, that all this work has been rooted in trust-based philanthropy. Normally, funders come together when they can touch and feel a program that has demonstrated results. And in this case, the whole of community system response was still just a concept and a true public and private partnership. To me, this is a testament to how community philanthropy can drive positive change. The donor family could have easily gone on their own on their journey to try to solve the crisis. But they knew, and they did have the capacity to do that. But what they recognized they needed was a partner that could steward the fund for change, and that's the role that the Community Foundation played, is providing governance, accountability, and transparency to our donors. For those of you who do not know London Community Foundation, we've been serving the community for 70 years, managing over 400 family funds and providing multi-generational granting, and we're stewards of philanthropic donations for community good. Through our donors, past and present, we provide a permanent source of capital for the community, ensuring we're responding to the needs of today and for tomorrow. So again, this is why this opportunity really aligned well with our values. I promise you that our team, our volunteer, our board of directors, and our committee members recognize the trust you've placed in us and the donor family. And we are fully committed to seeing this work through. So with that, I am proud to announce tonight that Londoners, you exceeded the $5 million community fundraising goal. In less than a year, the people of London have donated $6.2 million to the Fund for Change. Yeah, that's incredible. In less than a year. Thank you for your incredible generosity and your commitment to community philanthropy. This money was matched dollar for dollar, bringing the total to $12.4 million. That's what the community put together with the anonymous donor family matching the match. So, what I'd like to also share with you is that your donations to the Fund for Change are already working and supporting elements of the whole of community system response. And right there you will see that in total, the fund has put out $11.5 million in funding. So that was to support 2 hubs, which is YOU and Atlosa, in providing a combined total of $4.3 million to capital dollars to get those hubs operating, and as well as a total of $7.2 million towards future highly supportive housing developments, and that's the Elmwood Place and War Memorial Children's Hospital. Now, I know the two of you have heard, I know many of you have heard of the already existing highly supportive housing developments, which is Indwell on Thompson Road, and the House of Hope, which is on Dundas Street, which is a partnership between London Cares and LHSC. Those projects had already previous funding from the city. But we are so honored that collectively, this is putting people inside, permanently indoors. And that's really what the mission of this work is all about. Thank you. And now it's my honor and pleasure to introduce Jeff Macoun, recently retired as President and COO of Canada Life. Jeff has been a longtime vocal champion for our community. I'm amazed by Jeff's leadership. I have known him for the past, I'd say, 9-10 years, and he's one to never say no. Even though he's been leading a national company, he's there for big or small causes. And what I've learned from him is that community work matters. It's good for your community, and it's also good for you. And I hope that, and I'm sure that you're inspiring so many young people too to lead that way. And we really couldn't have done this without you. So no further ado, I will welcome Jeff Macoun.
Just like I wrote it, Diane. That was. It is really amazing, and good evening, everyone, that we're doing this. I mean, those stats on the screen are quite amazing, and it just makes me feel so proud coming here this evening and looking at our community. But we're doing this, and Scott and Josh will talk a little bit more about that. But as Diane mentioned, my name is Jeff Macoun. I'm co-chair of the Fund for Change Volunteer Fundraising Committee. When I was asked to take on this challenge, and Diane talked a little bit, in my heart, I really knew that it was the right thing to do and that I had to accept it. And as Diane mentioned, as an employee at Canada Life for quite a long time, I really felt an obligation to help out into the city. And many of us are longtime Londoners, and we can voice our opinions and talk about, or we can do something about it. And I really thought it was the right thing to do. But during the pandemic, we saw a dramatic change on our city streets. Storefronts closed due to the pandemic protocols, and people started working remotely. But our downtown, it really stood still. But over time, as people began returning to the office, instead of seeing signs of a recovering city, we saw people suffering. And I know each of you, as you visualize, you can see that. And it's not just the downtown, it's all through the city. And people were displaced due to the rapid increase in housing costs, unhoused people doing their best, just to survive. But I got to tell you, this wasn't the London that I'd come to call home and love since moving here close to 30 years ago. As a leader, I felt it was something that we needed to get after and get done. And I talked to the city in terms of expressing my concerns and asked how not only I could help, but also a big employer like Canada Life could help. And then one day, I got a call from the city and said, Jeff, have you got a minute? Maybe we could talk, and be careful what you ask for. But I had a chance to talk to Diane and Josh. And, I had heard about the health and homeless summits in the city being led by the then city manager, Lynn Livingstone, who is here. Lynn, where are you? I know you say, don't, there she is. What a rock, Lynn Livingstone. And I think I can see that, and it's bright lights over there, but also one of the first groups I've met, although I knew them for a long time, Lindsay and Jeff Sage, who really helped drive this for us and helped ourselves, said, hey, let's do this. But I got to tell you, as someone who has traveled across Canada, these summits were the start of something that was really quite unique to London. You'd go to different cities across Canada, but London, we were ahead of the curve. We are ahead of the curve. And we organized around an urgent issue, bringing experts from across sectors to help solve this homeless crisis. I'm really, really proud of that. And then, as Diane mentioned, when I learned that a very, very generous London family was working with the London Community Foundation on their pledge of $25 million to contribute to sustainable solutions, I knew the timing was right for all Londoners to step up. I've had the honor over this past year of working with the donor family and the London Community Foundation, the leadership of this great city, and a group of remarkably dedicated philanthropists. We kicked off the Fund for Change, as Diane mentioned, in September of 2023, just a little over a year ago. And at that time, we felt our $5 million goal was very ambitious at the time. There's lots of opportunities and causes in the city, so we thought the 5 was very aggressive. And as Diane mentioned, we surpassed that goal. And you know what? We're still building on that 6.2 million, thanks to you in raising the 6.2 million. And as Diane mentioned, this was then matched again by the donor family to $12.4 million. Quite incredible. You know, the donor family is not able to be with us tonight, but I have a message for them, and perhaps on behalf of all of us. We are deeply, deeply grateful for your commitment to our community and incredible generosity. Your initial gift supercharged all Londoners and all those who have donated in any amount, and you gave us hope that we can solve this crisis together. You know, I often think about this. A gift of this size, with a community match campaign to help unhoused people access stable housing, I don't know if it's ever happened in our community before or in Canada. You know, other cities, and Josh may talk about this, they're paying attention to us, London, Ontario, and they're trying to replicate what we're doing here in London, and I think that's fabulous. The level of integration and coordination of services has not been done before. It has put London on the map as an innovative and compassionate city that's leading the way in addressing homelessness. And that's why I was so proud that the company I've worked for, Canada Life, stepped up with a large gift. We credit the sector for coming together and the donor family for endorsing their work through this historic gift. The donor family is deeply committed to seeing positive change in people's lives and supporting the sector to implement this new system of care. On behalf of the donor family, we wanted to also thank the frontline workers and staff and leadership and everyone in social, health, housing, educational, emergency response sectors who are instrumental in making this new system of care a reality. We thank you for your tireless work and passion, and Londoners, I got to tell you, Londoners are grateful to you. I also had, and some of you as well that had the opportunity to attend the opening of the YOU hub on the LH campus the other day, where I was able to see firsthand, and Diane talked about the contributions of that, where I believe it's close to 15 beds, a little more than 15 beds, that we will be able to have youth off the street. So, like, it's happening right now. So a message I want to make sure you hear is that we're doing it and we're delivering. I'd also like to take this opportunity to acknowledge the members of the Volunteer Fundraising Committee. There are a number of them here this evening, and I wondered if you might just put your hand up or please stand. I know you're a very shy little bunch there, but and thank you so much for the work. Where are you? There you are. Come on, Murray. You've never been shy before. I see Jill and Wayne and Keith. Yes, thank you. Thank you for your determination and your leadership and support in getting us here. You know, we couldn't have done it without you, and I'm so proud of our accomplishments. You brought people in and opened their hearts and minds about how we can address the complex challenges of homelessness by coming together as a community. And I should mention the London Community Foundation. Thank you for being stewards for the Fund of Change and for supporting the Volunteer Fundraising Committee all along the way. You know, this is one of the things I love about this community, because this is a unique partnership, and the community appreciates how the foundation is supporting the donor family, aligning your work to help address homelessness, and working alongside the City of London. We know homelessness can't be solved alone by one group. It takes multiple partners and the community, and this is why I'd also like to thank Lynn Livingstone, the former city manager, for spearheading this work 2 years ago. I'd also like to thank Sandra Dietersbeer, the new city manager, Kevin Dickens, deputy city manager, and of course our Mayor Josh Morgan for their leadership in keeping this work alive and moving forward. I encourage you to continue to stay the course of this. So in conclusion, everyone, I would just like to thank everyone for this amazing opportunity to say hello, but I also wanted to say, but none of this would be possible without the social sector, the frontline workers and agency leadership who are shaping and implementing the whole of community system response. We know you are working really hard and with compassion and care and under very challenging circumstances. We're grateful. I'd now like to pass it on and introduce Scott Courtice, Executive Director of the London Intercommunity Health Centre and former co-chair of the Health and Homeless System Response Strategy and Accountability Table. Thank you very much, everyone.
Hello, good evening, everyone. It is so good to be here with all of you tonight. And let me start by saying the work that we've done together over the past 2 years, those of us that are doing the work on the ground, and those of you that are working so hard to raise donations, has been nothing short of extraordinary. And we don't pause enough to reflect on that. So I'm glad that we've had the opportunity to do that today. But I hope this evening we're not just here to reflect, but to recommit, to acknowledge the scale of the crisis that we're facing, to acknowledge the progress that we've made, and to continue to remind ourselves why this work continues to matter. But before we go any further, we're here, and I'm honored to have the opportunity to thank all of you and what you've done. The $25 million donation that launched the Fund for Change, and then the additional $6.2 million that was raised by this community, it provides resources, but it also sends a powerful message. It told the people of our community that when we face a crisis, we come together and we act. So I want to recognize the leadership of the London Community Foundation for stepping into this space and taking a risk on this work. From the very beginning, the vision of the foundation and the leadership of the committee that raised this money has really been incredible. And they asked tough questions and certainly have kept us on our toes, but it has been incredible leadership. So tonight, I have a microphone in front of all of you, which is an opportunity I usually relish. So I want to reflect on three things. I want to continue to reflect on the depth of the crisis that we're facing, the power of our collaboration, and then I also want to speak about the role of harm reduction, which is a critical but often misunderstood element of our plan. And I can say that truly had dinner with my parents on Monday, and definitely dinner conversation, and I'm sure it's something that's dinner conversation with you as well. So happy to reflect on that a little bit tonight. So the depth of the crisis. Let's talk about why we came together and why we remain together. The homelessness crisis in London isn't abstract. It's real, it's urgent, you can see it. Since 2020, the number of people experiencing homelessness in our community has doubled. The number of individuals sleeping rough outdoors has quadrupled. Thousands of Londoners are waiting for affordable housing while rents get higher and higher. These aren't just numbers, these are people. They're parents, children, neighbors, friends who are living on the edge. Their health, their safety, and their dignity are all at risk. And the crisis doesn't just affect them, it ripples through every part of our community, from our small businesses, our neighborhoods, and to the very fabric of who we are as a community. So years ago, it's 2 years ago now when we first came together to do this work, faced with this crisis, we had a choice. We could ignore it, we could point fingers, or we could step up. And I'm very proud to say that as a community, all of you in this room, boy did we step up, and boy do we continue to step up. So 2 years ago, something remarkable happened. Over 200 leaders from 70 organizations came together. Not just the usual players that are in this work, but a coalition of unusual suspects. Healthcare providers, both small and large institutions, housing advocates, business leaders, frontline workers, developers, people who may not always sit at the same table or share the same perspectives. And out of those conversations came the whole of community response. I'm really proud that we did this as a community. Not all communities have the courage to do work in that way. At the core of the whole of community response were two key pillars: hubs and highly supportive housing. And hubs, as I hope you know by now, are places of stability where people can find shelter, healthcare, harm reduction, housing support, all under one roof, provided by a team. They're open 24/7, and they don't just meet immediate needs, they provide a pathway to better health and to long-term housing. Highly supportive housing, which offers long-term homes with wraparound support tailored to address the complex needs of people living within them. These aren't just places to sleep, they're places to rebuild, places to find safety. And here's the thing, this wasn't just a plan, it's happening. 2 hubs are already operational, one focused on youth, led by Youth Opportunities Unlimited and London Health Sciences Centre, and another Indigenous-focused hub led by Atlosa Family Health Services and St. Joseph's Healthcare. We have a provincially funded hub waiting for approval, and I know we'll have more hubs on the way soon. Thanks to the many people and organizations in this room, we're also making progress on the goal of creating 600 highly supportive housing units in the next 3 years. And I'd like to give special recognition to our development community. And I don't know if Mike Wallace is here, but Mike Wallace at the London Development Institute and others, whose partnership has been fundamental and is unique to London. We all share the goal of bringing everyone indoors, ensuring every person in our community has a safe place to go home. But we also know that this takes time. It won't happen overnight, and it's not happening as fast as we'd like. So in the meantime, we recognized as a whole of community response the need to come together and develop a plan to support those who remain outside, living in encampments. Now, this plan is currently considered by council. I understand it was a very long meeting last night, and it's often a case in democracy. There are differing opinions on how best to move forward. That's okay. Disagreement, when done in good faith, is part of the process. But here's what I believe, and I know will hope guide us all. Whatever plan emerged to support Londoners who are living outside, it will be rooted in respect for the dignity and the human rights of those people. The rest of Canada has held up London as a leader in upholding this principle, and I'm so proud and I trust that we'll continue to do work in this way, and I know that we'll move forward together with our elected officials. So let's be clear. We are still in the middle of a crisis. There is just no way to sugarcoat that, and there's still a lot of hard work ahead of us. But at the same time, we can take a moment to acknowledge what has been accomplished. And what we've done here is inspiring other communities, including our provincial government, showing people that progress is possible, even in the face of deep desperation. And it keeps me going when I get out of bed in the morning thinking about that. Now, I'd like to spend a moment on harm reduction, because let's face it, this is one of the topics that can make people uncomfortable. It can be misunderstood. So I want to tell you what harm reduction really is. Harm reduction is about saving lives. It's about recognizing that without life, there can be no treatment, there can be no recovery, no stability, no second chances. Harm reduction is about not expecting people to stop using substances as a precondition of accessing services. It's about meeting people where they are, not where we wish that they were, and providing them with the tools to reduce immediate risks, whether that is access to sterile needles, to reduce the spread of HIV and Hep C, prescribing alternatives to the toxic drug supply, distributing naloxone to reverse overdoses and prevent death, or supervised consumption sites. And here's the key. Harm reduction is not in competition with treatment or recovery or any other health services. It keeps people alive increases their safety, and that helps make treatment and recovery possible. Now, I know, and I'm disappointed, that this approach can be politicized, but we have to rise above that. We have to stay focused on what works, and in London, with a few notable exceptions, we've chosen compassion over division and evidence over populism. It's a unifying principle of our whole of community response, and as long as I am involved, it will continue to be so. So looking ahead, and I said that to my mom on Monday, and it went over well. As we look to the future, let's remember this. Homelessness is not inevitable. It is the result of public policy choices, and that means it's solvable. We've proven that when we work together, when we combine innovation, determination, compassion, we can make real progress. What we need now, in my humble opinion, is for the same spirit of collaboration and determination to transcend our provincial and federal governments. We need them to put their differences aside for the greater good and to align their programs and funding to help local communities like London to turn our visions from ending homelessness into a reality. And I want to thank our mayor for doing such an excellent job of bringing that message to those governments and for stewarding the work with those other levels. I'll also ask something of all of you. We're going to be in elections soon, so please talk to candidates at the door and invite them to join in that movement. Ask what their plans are for housing and demand that we get past the division and get on to solving this problem together. So tonight, soapbox aside, I want to thank you, not just for your generosity, but for your belief in what we can achieve together. We've made progress. We really have. I need you to know as donors that we have made real progress and there is hope, but we still have enormous challenge in front of us. So let's keep going and let's recommit, and thank you for your generosity.
Thank you, Scott. And you said it so beautifully. Now it's my pleasure to invite our mayor, Mayor Morgan, to the stage to give us an update on where things are at with the city and the whole of community system response. Thank you.
It's always scary when I bring my water up with me. First off, I want to thank my colleagues on the stage who've spoken before me because they've covered a lot of really important ground. And so the first thing I want to repeat with what they said is thank you to everyone in this room. Whether you're a donor, whether you're a volunteer, whether you're a member of the cabinet, whether you're a frontline or agency worker, someone involved in the whole of community response, someone who used to be involved in the whole of community response, you know, none of this actually happens. This conversation and this event doesn't even happen without the incredible work that all of you have done to bring us as far as we have come. With that, I've got one piece of paper. It's actually not even my notes. It's something from Chris Moss's organization. Because I tend to, on this topic, want to just speak very genuinely and from the heart and off the top of my head. I know a number of things I want to talk about. I apologize. I know everybody wanted me to say certain things. I might miss a few things. But I'm going to be genuine and frank on some things that I think are out there in our discussions in the community. First is I echo the incredible thanks for the generosity of everybody who has given to the Fund for Change and for the anonymous donor family who really created the catalyst for even getting as far as we have. It is often said, where did the $25 million go? And what did you do with it? And I get that question a lot. Like, a check was, as we know, never written to the city. This is properly done, stewarded by a professional organization in the London Community Foundation to ensure that as money is raised, as money comes in, as donors donate, that it is going directly to where it is supposed to go to with all of the checks and balances that need to be in place. And I cannot thank the Community Foundation enough for being a leader in this space generally, but taking on this really important initiative. This is community money raised by the community, stewarded by the Community Foundation, controlled by the community to support a community plan. It is not the city's money supporting the city's plan. The city is an exceptionally important partner in this work because we have platform, we have capacity, we have staff who can help, and I, as mayor, have the ability to go out and be a lead advocate, not just here in the city, but across the province for what needs to be done to actually take the good and generous donor work and magnify that into actual action that will make some change on the ground. And so my focus all along has been on the core fundamental basis of this, the same things I said at my first State of the City when I had the distinct honor to be able to announce the donation and put the parameters for the fundraising challenge out there. You know, housing is healthcare, and it's a fundamental human right. I remember at the time, Lynn and I had a conversation about, can I say that? Or am I gonna get myself in trouble? Because you're talking about fundamental human rights and you're saying housing is. And I did say it. And now people say it all the time because it's true and it should be. But that means all of this work we're doing, whether we're talking about hubs or bringing people indoors, all of it must be focused at the end of the day on getting people housed with the proper supports around them to ensure that they remain housed. Full stop. So when you see me in the paper or in the media saying, I'm not fixated on the number of hubs that we may have been committed to, that's because I'm not fixated on the intermediary step, which I agree is absolutely necessary. I'm fixated on the final step, people housed permanently with proper supports and successful in their housing journey. People no longer on the streets or in encampments, but housed at the end of the day. So why are hubs important? Because the way that people go from encampments in the street right now is into the emergency room. And then they're probably back into being unhoused, and then back to the emergency room. And they're probably taking a land ambulance through that transition. Another group of people may be going into police custody, and then back into homelessness or being unhoused, and then into police custody, or maybe the emergency room. Maybe some people, spin off to supportive housing and find their pathway there, but it is not what is predominantly happening. So a hub, as has been described, that is the intermediary step. The stabilization piece where we can bring people indoors, wrap them around with the proper services, start to find out what type of housing is right for them, and then in the most optimistic of cases, and in what is now becoming with experience commonplace, lowering their acuity level and finding them different forms of housing, not just highly supportive housing, but different, less costly forms of housing that is now right for them because they've been stabilized. Because remember, our work here isn't to solve homelessness generally. That is the work of every level of government and every council and every person across this country. But the specific work of the whole of community response is how do we help the highest needs individuals, those who may be banned from shelter, those who actually need supports wrapped around them, those who need a hub and highly supportive housing to actually be successful, those who, if you gave just an apartment to and the keys, will likely fall out of that house situation back into the situation that they're in today. That is not success. Success is stable housing for the long term permanently. So why is supportive housing important? Why would we be saying we want to spend your money, and why are the plans to spend the money raised on creating supportive housing spaces? Because we actually know this works. When I stood up, and I remember Jeff telling me this story, when I stood up at the State of the City and said, we're going to do this, I remember Jeff saying, like, I'm in, but I don't know how. Like, we don't have a plan. We're not sure. There's the people talking at the summits, but like, where is this going to go? Where we've come to today is we know what works. We know what works, and we have a plan. And we know that that plan works because we now have data. So although not part of the whole of community response, the incredible work that's been done through London Health Sciences Centre and London Cares at the House for Hope, we know that in the 6 months before people went into that facility to the 6 months after, we can actually gather and share data. The individuals, the differences is phenomenal. 86% fewer emergency room visits. And those emergency room visits were usually dependent upon the land ambulance system. 57% fewer days spent in hospital as an inpatient. 63% fewer days in custody. 51% fewer interactions with police. And then there are some very specific stories. One resident had spent 188 days in custody in 2003, but since being in highly supportive housing has spent 0 days in custody. Someone else, in the 6 months before, 103 times in the emergency room. Since then, 7, a 93% reduction. When you think about an emergency room being about $1,400 a night, you think about the investment that it takes to bring people off the street, the math starts to get really easy to say, this is a better use of money. If you're a community member who wants to go to the emergency room and not have long wait times, providing proper care for those who need it, who are consuming a massive amount of services in our community because they have to, and finding a better path for them, helps every Londoner. And everybody regionally who depends on our hospital and healthcare system. This is stuff that actually works. This is stuff that we have data on. Where we have a problem is scaling this up. So you have given us this amazing, generous gift in being able to deploy capital in the way that you see, and sometimes short-term operating dollars. And what you've also done is given us the ability to prove something that works. And so what have I done with that? I've gone out aggressively with the provincial and federal governments and said, this is a model that works, you need to invest in it. And although the Heart Hubs is not exactly the model we've designed, it's 90–95% the same. And now the province has put almost $400 million towards doing this. And the most amazing thing about that is not only is the province committing operating dollars now that they weren't when we started this journey through the Heart Hub system, but there were over 90 communities and 90 applications saying, although there are only 19 spaces or 19 facilities available, we want one. People have figured out that this works. Communities and organizations across this province have said, we actually want these services in our communities because we want to help people. This idea that if we were going to create something that was unique and new, everybody was going to come to our city is not true. The opposite has happened. Communities across this province have said, we want to be part of the solution, we want to help the members of our community who are suffering, and we want to be part of it. And the provincial government, with proof of concept, will, I think, and I believe they will, put up more money when we show them that these things work. When we show them that we can save them dollars in the healthcare system if we just get people housed properly with proper supports. This is the phenomenal thing. Now, this is where, I don't know if anybody out there is going to run for mayor next time, but I want to give you a tip. This is not a good topic to take on as a mayor because you don't get a lot of credit for it. And if it starts to work, people don't see it. So when I go out there and people say, it's not working, because when I go downtown, I see people still on the street, or I see people still using drugs, or I see people still with significant challenges. What you don't see, and what is working, is the 50 people in the facility that I talked to, or the 50 people who have gone through the YOU temporary spaces, just 6 spaces, 50 youth have gone through that, and 30% of them are fully permanently housed now. Or the 40 people who are in supportive housing on Thompson Road, or the people who are in a variety of Indwell facilities. If you want to see the problem we could really have, put all of those people back out on the street, on top of the problem we have. You don't always see progress because people are not creating an impact. But that progress is happening. The statistics don't lie. The people whose lives we've changed know that this works. The provincial government knows that this works. We know that it works. The donors in this room know that it works. Our work now is to convince and prove that this is scalable. And that's why the whole of community system response is so important. Not only do we have council-supported and community-supported plans on highly supportive housing and hubs, but we have a unanimously supported data and measurement framework that we know, professionally analyzed by researchers at our healthcare and post-secondary institutions, that will prove beyond a shadow of a doubt that the data we know, we've seen in small circumstances, is actually working on a wider scale, and that this is a place to invest. And so this is the work that remains ahead of us. There is a lot of noise with this. It is an incredibly difficult space to work in. Incredibly difficult. When you have distractions across this province about people and other mayors writing letters to the Premier asking for things that, frankly, in this community don't help me at all, And when I've spoken to elected officials at the provincial level, I've said, I know that you want to give some tools to me, but actually give me the tools that I know will work. Give me more funding for affordable or for supportive housing spaces. Give me more capacity to open more hubs. Give me the amount of, an increased amount of provincial supported treatment and recovery spaces that has been talked about. Let's build some of those in our community too. Give me those things. Don't give me tools that aren't going to actually help me move the grounds. Because when that happens, all I get set up for is failure. I get provided tools that aren't going to move the ground, and then the community is going to say, why isn't the change getting better? We know where we need to invest. We know what works. That is our ask. That is the ask of 28 of 29 large Ontario city mayors who have unanimously come together to say, we need your support in this space. And I totally respect that I've got other colleagues who have differences of opinion and are asking for different things, but the consensus position of the Ontario big city mayors is invest in this space like London is doing, is invest in these resources that we know help people and pull them out of the circumstances they're in. So that is the work that I will continue to do, and that is the work that we have ahead. I don't want anybody to get frustrated. Like, these things are working. When you see Erica's story, get ready, because there are going to be more and more stories about people whose lives have been transformed. When you get to stand in that YOU hub, when you know that with only 6 spaces, they've helped 50 people in less than a year move through that system, think about what they're going to do with the increased capacity in a new space that you in this room have helped create. Think about all of those lives. Don't worry about the noise in the media or the noise in the public. Think about the lives that are fundamentally going to be changed, and their stories, when they start to stand up and tell them, when they start to become members of the community who start advocating for their peers who don't have spaces yet, and say, we need more dollars, we need more investment, we need more spaces so that my friend can come through and have the same opportunities I have, those are going to be the powerful voices that are going to drown out some of the noise that you get through the more difficult challenges of navigating through this process. Because it's challenging. You get beat up all the time on it, right? And I know that it's hard because you see different stories in the media and it can create some confusion. But make no mistake, and I am fully committed to the whole of community response plan to create supportive housing spaces and create more hubs in the city. We may have paused some of the work on the hubs as we put our full efforts towards applying for the Heart Hub, but we will open a new RFP very soon to do an intake for more organizations who are willing to have more hubs hosted in this community, and we are not going to stop creating supportive housing in this community by any means. We are going to work with whoever we can, whether it's developers, partners, Vision Soho Alliance members, anybody who wants to partner with the city to create supportive housing spaces. We are going to partner with them, and we are going to find a way to get the permanent operating dollars to ensure that those spaces remain in our community. Because when we create one of those spaces, we don't help not only just the person who's off of that street, but we get permanent, long-term operating dollars to continue to help someone and flow them through. Flow through is incredibly important. We are not going to create spaces for hundreds and hundreds of people off the bat. So the more people we can flow through the spaces we get, every time we get a space, we create an opportunity for people to move through that space into permanent supportive housing. That helps us meet our mission and meet our goal. I want to finish, because I have no idea how much time I was supposed to have. That's what happens when I don't speak with notes, and I'm sure Diane's like, you're way off, you're way more. I want to finish by recognizing, I know a number of groups have been recognized today, and I don't want to take away from anybody who I'm not going to recognize in this moment, because I think all the donors and all the work has been done, but there are a group of people who are invited to be here today, who include frontline workers in the space, people who have taken time away from the frontline work to work in that room as part of the whole of community response, people who go out each and every day and see the impact of this work and see the need of this work and how important it is to be able to scale it up. There are members in this room from the whole of community response, from the tables. I want everybody to recognize for all the difficulty that I say I have in this work, their work is the most difficult. They see this every day. They have clients who have died and they no longer get to talk to. They have people who they know are on the verge of meeting the same fate on our street because they know we cannot scale this up fast enough because there simply aren't the resources. Their work and coming in and doing this each and every day is nothing short of phenomenal. They are heroes in our community because they continue to show up and do this and believe in it despite all of the challenges and all of the noise and how slow it sometimes goes at times. So thank you, and join me in thanking those members for the work that they do. And with that, again, thank you to everybody in this room for taking the time. Thank you to the Community Foundation, and thank you to the other panelists up here who shared some thought-provoking thoughts and great new information. And again, to be able to say that we've now raised over $6 million in less than a year when the goal was 5, like, that speaks to what London is. That speaks to the heart of the community, and that's the city that I'm proud to be mayor of. Thank you.
Thank you, Mayor Morgan. And I just want to close by acknowledging, for real, I've been working with Jeff Macoun, and even before Jeff Macoun, it started with Mayor Morgan and Lynn Livingston and Scott on the early days about this. And they have been committed all the way through. And I also want to commend the work that the city has done, the city administration, Sandra Dada-Beer, Kevin Dickens, just to name a few. They deeply care about this work. And I've also had the honor of attending the strategy and accountability table meetings. And I'm witnessing, like, here I am as part of the foundation. I'm not doing any of this frontline work, and I'm hearing the voices of these leaders, and they're talking to each other and collaborating and being vulnerable and showing up, and that motivates. Like, even though it's hard sometimes to sit in these rooms and to listen the stories that they're sharing and the complexities that they're dealing with, and we know that the headlines in the media aren't always the best, and the politics that goes with this, but my God, it just makes you feel like we got to get this done. And so thank you to you, the donor community, for stepping in, not knowing fully what this was going to be like, but just like you've heard from Scott and Mayor Morgan about the impact of this work, I hope you continue to lean in. And I know that this work just won't stop with the 600 that we're trying to house permanently. There's so many other people out there. So there's a lot of work that needs to be done, and we need the whole community behind this. So thank you to all of you, your leadership, and I hope you feel inspired, even though this is a heavy conversation and a heavy topic. I hope you feel proud of the community that you're part of. I'm not kidding you. I'm talking to communities across the country. You know, I know Mayor Morgan's been part of these talks, and they're asking us, how did this happen? How did you guys do this? So London, you should be very proud, all of you, the sectors, your leadership, the donor community, everyone. And we're going to we recognize that communication hasn't been the best, and that's because we know we can't just rely on media to do it all. Media tries to do what they can, but we're going to try to keep you informed more regularly. But even if there's moments of pause, know that there's a lot of work being done behind, or you know what I'm trying to say. I'm trying to sound so profound here, but you know what I mean. Anyway, all to say, thank you so much. I hope you enjoyed tonight's talk and that you walked away with more of a deeper understanding. And thank you all, and I hope you have a great evening. Thank you.